Bob Blackman.
Thank you very much, Mr. Deputy Speaker. And I strongly support this bill that is before us tonight for its second reading. Can I set out, though, although there are strong measures to combat obesity in the bill, there are none to tackle smoking, which is the leading cause of preventable premature death, including cancer. Now, I would say that I declare my interest as the chairman of the all-party parliamentary group on smoking and health. The paper that we produced, the report that we proposed, suggested that we have the polluter pays levy that the government promised to consider 2 years ago implemented. This bill is the ideal opportunity to introduce that. Now, given that the analysis that Cancer Research UK have carried out, that we won't achieve the government's aim of a smoke-free England until 2035, when the government is aiming for 2030, which is a decade later than in our poorest communities, there is actually no time to waste. We need to get on with this particular job. Now, in the recent paper that the government set out on public health, the government accepted that it not only had a responsibility to help people improve their own health, but also to go further when it came to industries that are based on addictions like smoking. Now, here is the ideal opportunity, and I urge the government to consider the recommendations laid out by the all-party parliamentary group and introduce those as amendments during the committee stage of the bill, so that we tackle the most deadly addiction that exists in our society. Now, of course, we need to combat not only smoking rates, but as well as the long-standing unacceptable health inequalities that exist across the country. But this plan needs to be comprehensive, and it won't be effective without sufficient additional and sustainable funding. A smoke-free 2030 fund, using the industry to pay for it, but without industry interference, could pay for the comprehensive measures that we need to reach the ambitious target across all socio-economic groups. I also mentioned in relation to the plan to combat obesity, it seems to me that there is a measure that will be harmful to many of our media companies, but not actually hitting some of the social media and some of the online companies. That runs the risk of having a two-stage process. Perhaps we could consider having limits at weekends to limit the impact of junk food advertising on our TV when our young people are watching. But overall, Mr. Deputy Speaker, this is a good bill. We should support it, and we should support our National Health Service that's brought it forward before us today.